5 early signs of kidney damage you must not ignore. When it comes to your health, it's easy to focus on issues you can see or feel right away. But some of the most important aspects of your health often go unnoticed until it's too late. One of those areas is your kidneys. These two bean-shaped organs play a critical role in keeping your body balanced, removing waste, and maintaining your overall well-being. However, kidney damage can be sneaky, creeping up on you without any warning signs until it's at an advanced stage. Kidney disease is often referred to as a silent killer because the symptoms may not be noticeable until there is significant damage. According to statistics, around 37 million adults in the United States alone have chronic kidney disease, CKD, and millions more are at risk of developing it. What's more concerning is that most people don't know they have kidney damage until the disease has progressed. This is why it's essential to understand the early signs of kidney damage and take action as soon as possible. In this video, we will cover 5 early signs of kidney damage that you must not ignore. These are subtle signs that can give you clues about your kidney health, and recognizing them early can help you seek the right medical advice and take preventive measures to avoid further damage. Sign 1. Fatigue and weakness. One of the earliest signs of kidney damage is unexplained fatigue and weakness. While feeling tired every now and then is normal, especially after a long day, the kind of fatigue associated with kidney problems is different. It's persistent, unrelenting, and doesn't go away even after rest. This type of fatigue can interfere with your daily life, making even simple tasks feel overwhelming. Why does this happen? Kidneys are responsible for filtering waste products and excess fluids from your blood. When they become damaged, they can't do this job as effectively, leading to a buildup of waste and toxins in the body. This accumulation of waste can make you feel tired and sluggish. Another important role of the kidneys is to help produce a hormone called erythropoietin. This hormone tells your body to produce red blood cells, which carry oxygen throughout your body. When your kidneys aren't functioning properly, they may not produce enough of this hormone, leading to a condition called anemia. Anemia causes a reduction in the number of red blood cells, which means less oxygen is being delivered to your organs and muscles, leading to fatigue and weakness. What to watch for? If you find that you are constantly feeling tired, weak, or out of breath, even after a good night's sleep or minimal activity, it could be a sign of kidney damage. You might also notice difficulty concentrating, memory problems, or feeling dizzy, which are all linked to decreased oxygen levels in the body. Many people brush off fatigue as a normal part of aging or stress, but if it is persistent and accompanied by other symptoms, it's worth considering whether your kidneys could be involved. If you experience this kind of unexplained fatigue, it's important to speak with a healthcare provider and get your kidneys checked through blood tests and urine analysis. Sign 2. Changes in urination patterns. Another early warning sign of kidney damage is a change in your urination habits. Since your kidneys are responsible for filtering and removing waste from your blood to produce urine, any damage to the kidneys can result in noticeable changes in how often and how much you urinate, as well as changes in the appearance and consistency of your urine. Signs to watch for. One of the most common changes you may notice is an increased frequency of urination, especially at night. Waking up multiple times during the night to go to the bathroom is known as nocturia, and it could be a sign that your kidneys are struggling to function properly. Another potential sign is a decrease in the amount of urine you produce. Even if you're drinking the same amount of water, you may notice you're urinating less frequently or producing smaller amounts of urine. On the flip side, you might also experience an increase in the amount of urine. but the urine may be pale or almost clear, which could indicate that your kidneys aren't filtering waste effectively. In addition to changes in frequency, pay attention to the color and appearance of your urine. Healthy urine is typically pale yellow. If you notice your urine becoming foamy, excessively bubbly, or darker in color, it could be a sign of protein leakage, which occurs when the kidneys are damaged. Protein in the urine is one of the earliest indicators of kidney disease, and it's something you should never ignore. Another important change to look out for is blood in the urine. Blood in the urine, hematuria, can appear pink, red, or brown. This can be a sign of kidney damage or other serious conditions like kidney stones or infections. Blood in the urine should always be investigated by a healthcare provider immediately. Why it happens? When your kidneys aren't functioning properly, they lose their ability to filter waste and regulate fluid balance, which leads to noticeable changes in urination. Damage to the tiny blood vessels in the kidneys, called glomeruli, can cause proteins and blood cells to leak into the urine, resulting in some of the changes you may observe. If you notice persistent changes in your urination patterns, such as increased frequency, changes in color, or the presence of blood, it's important to seek medical advice. Early detection through urine tests and kidney function tests can help identify potential issues before they worsen. Sign 3. Swelling in feet, ankles, and hands. Another early sign of kidney damage is swelling, also known as edema. Swelling can occur in various parts of the body, but it's most commonly noticed in the feet, ankles, and hands. This swelling happens because damaged kidneys are unable to remove excess fluid and sodium from the body, causing it to build up in the tissues. Why does this happen? Healthy kidneys regulate the balance of fluids and electrolytes in your body, including sodium. When your kidneys are damaged, they can't filter out excess sodium and water effectively. As a result, fluid begins to accumulate in the tissues, leading to visible swelling. The swelling usually occurs in areas where gravity pulls the fluid down, such as the lower extremities like your feet, ankles, and legs. Signs to watch for. Swelling related to kidney damage typically starts as mild puffiness in the feet and ankles, but it can gradually become more noticeable and uncomfortable. You may notice that your shoes feel tighter, or that you have indentations in your skin from your socks or shoes. In some cases, the swelling can spread to the hands, face, and even around the eyes, making them appear puffy. It's important to note that swelling can have other causes, such as heart disease or liver problems. However, if the swelling is accompanied by other signs of kidney damage, such as changes in urination or fatigue, it could indicate an issue with your kidneys. Swelling that persists or worsens over time should be evaluated by a healthcare provider to determine the underlying cause. What can you do? If you notice swelling in your feet, ankles, or hands that doesn't go away after rest or elevating your legs, it's important to consult a doctor. They may recommend tests to check your kidney function and assess whether the swelling is related to kidney damage or another condition. In the meantime, you can try reducing your sodium intake and staying hydrated to help manage the swelling. Sign 4. Shortness of breath. Shortness of breath can be another early indicator of kidney damage. It's a symptom that many people may not immediately associate with kidney health, but it can occur due to several reasons related to impaired kidney function. When your kidneys aren't working properly, they can't remove excess fluids from your body, and this can lead to fluid buildup in unexpected places, including your lungs. Why does this happen? There are two primary reasons why kidney damage can cause shortness of breath. The first is fluid overload. When the kidneys can't filter out excess fluid, it can accumulate in the lungs, leading to a condition known as pulmonary edema. Pulmonary edema makes it difficult for oxygen to pass from your lungs into your bloodstream, causing shortness of breath. You may find it hard to catch your breath, especially after physical activity or while lying down. The second reason is anemia. As mentioned earlier, your kidneys produce a hormone called erythropoietin, which stimulates the production of red blood cells. When kidney function declines, the production of this hormone decreases, leading to anemia. Anemia reduces the amount of oxygen that your blood can carry to your organs, including your lungs, making it difficult to breathe properly. Signs to watch for: if you experience shortness of breath, especially when lying flat or after minimal activity, it could be related to kidney damage. You might also notice a feeling of tightness in your chest or wheezing, which can be signs of fluid buildup in the lungs. In some cases, the shortness of breath may be accompanied by fatigue or dizziness, further indicating a potential issue with oxygen delivery in your body. What to do? If you're experiencing persistent or unexplained shortness of breath, it's important to seek medical attention. Shortness of breath can be a sign of many conditions, including heart problems, lung disease, and anemia, but when paired with other symptoms of kidney damage, it should not be ignored. Your doctor can run tests to evaluate your kidney function and determine the cause of your shortness of breath. Sign 5. High blood pressure. High blood pressure, also known as hypertension, is both a contributor to and a consequence of kidney damage. The connection between your kidneys and blood pressure is complex and significant. Understanding this relationship can help you recognize the implications of kidney damage and the importance of monitoring your blood pressure for overall health. Why does this happen? Healthy kidneys are essential for regulating blood pressure. They achieve this by filtering blood, removing excess fluids, and balancing electrolytes such as sodium. When the kidneys are damaged, they can lose their ability to effectively manage these processes. As a result, the balance of fluids in your body can be disrupted, leading to increased blood volume. This increase in blood volume can elevate blood pressure, causing hypertension. Furthermore, the kidneys produce a hormone called renin, which helps regulate blood pressure by controlling the constriction of blood vessels. When kidney function declines, there may be an overproduction of renin, leading to constricted blood vessels and, ultimately, higher blood pressure. This creates a vicious cycle, as high blood pressure can further damage the kidneys, worsening their function. Signs to watch for high blood pressure often goes unnoticed because it typically does not produce symptoms until it reaches a dangerously high level. However, there are some signs and symptoms that could indicate you're dealing with high blood pressure, especially if it is related to kidney issues. Headaches. Frequent or severe headaches can be a sign of high blood pressure. They may occur especially in the morning or become more intense as the day progresses. Dizziness or lightheadedness. If you feel dizzy or lightheaded, especially when standing up, it may be a sign of fluctuating blood pressure levels. Nosebleeds. Although less common, sudden nosebleeds can occur with extremely high blood pressure. Vision problems. Changes in vision, such as blurriness or seeing spots, can be linked to high blood pressure affecting blood vessels in the eyes. Shortness of breath. As previously discussed, if your kidneys are not filtering fluid properly, this can lead to fluid buildup in the lungs, which can manifest as shortness of breath. If you have a family history of hypertension or kidney disease, it's especially important to monitor your blood pressure regularly, as you may be at greater risk. What to do? If you have high blood pressure or suspect that you might, it's essential to work closely with your healthcare provider to manage it effectively. Here are some steps you can take to help control your blood pressure and protect your kidneys. Regular monitoring. Get your blood pressure checked regularly. Your healthcare provider may recommend home monitoring to keep track of your readings. Lifestyle changes. Adopt a heart-healthy lifestyle. This includes eating a balanced diet that is low in sodium, maintaining a healthy weight, engaging in regular physical activity, and limiting alcohol intake. Medications. If lifestyle changes aren't enough to control your blood pressure, your doctor may prescribe medications. It's important to take these as directed and attend regular follow-up appointments to monitor your blood pressure and kidney function. Reduce stress. Managing stress through techniques such as mindfulness, meditation, or yoga can also have a positive impact on blood pressure levels. Avoid tobacco products. Smoking can worsen kidney function and increase blood pressure. Quitting smoking can lead to improved health outcomes for both your kidneys and your cardiovascular system. By being proactive in managing your blood pressure, you can significantly reduce your risk of kidney damage and maintain overall health. Now that we've discussed the 5 early signs of kidney damage, it's essential to emphasize the importance of preventive measures. Recognizing these signs early can lead to timely intervention and potentially prevent further kidney damage. Here are some actionable steps you can take to maintain your kidney health and overall well-being. 1. Stay hydrated drinking. Enough water is crucial for kidney health. It helps your kidneys effectively filter waste and toxins from the blood. Aim for at least 8 8-ounce glasses of water a day, but this may vary based on your activity level, climate, and individual health needs. Staying hydrated can help reduce the concentration of waste in your urine and prevent the formation of kidney stones. 2. Monitor your blood pressure. If you have risk factors for kidney disease, keep a close eye on your blood pressure. Normal blood pressure is generally considered to be around 120 over 80 millimeters of mercury. If your readings consistently fall above this range, you should consult your healthcare provider. Managing high blood pressure is crucial for preventing kidney damage. 3. Eat a balanced diet. A healthy diet plays a significant role in kidney health. Focus on a diet low in sodium, saturated fats, and added sugars. Incorporate plenty of fruits, vegetables, whole grains, and lean proteins. Foods rich in potassium, like bananas, spinach, and sweet potatoes, can help counteract sodium's effects on blood pressure. If you have existing kidney problems, you may need to limit potassium and phosphorus, so consult your healthcare provider for personalized dietary advice. 4. Exercise. Regularly physical activity is vital for maintaining a healthy weight, controlling blood pressure, and improving overall cardiovascular health. Aim for at least 150 minutes of moderate aerobic exercise each week, such as walking, swimming, or cycling. Strength training at least twice a week can also help enhance overall fitness and health. 5. Avoid smoking and limit alcohol. Both smoking and excessive alcohol consumption can harm your kidneys and raise blood pressure. Quitting smoking is one of the most significant health improvements you can make. Aim to limit alcohol consumption to moderate levels, up to 1 drink per day for women and 2 for men. 6. Manage stress. Chronic stress can contribute to high blood pressure and negatively impact your overall health. Incorporate stress reduction techniques into your daily routine, such as meditation, yoga, deep breathing exercises, or spending time in nature. Prioritizing mental health can improve your physical health as well. Regular medical checkups are essential, especially if you have risk factors for kidney disease, such as diabetes, hypertension, or a family history of kidney problems. Your doctor can perform routine blood and urine tests to assess your kidney function and identify potential issues early. Certain populations are at a higher risk of developing kidney damage. These include individuals with diabetes, High blood sugar can damage blood vessels in the kidneys over time. People with high blood pressure, chronic hypertension is a leading cause of kidney disease. Those with a family history of kidney disease. Genetics can increase your risk. Individuals with cardiovascular disease. Heart issues can impact kidney function and vice versa. If you belong to any of these categories, talk to your healthcare provider about regular screenings and preventive measures. If you experience any of the early signs of kidney damage we've discussed, such as persistent fatigue, changes in urination, swelling, shortness of breath, or high blood pressure, don't hesitate to make an appointment with your healthcare provider. Early intervention is crucial in preventing further kidney damage. Your doctor may recommend blood tests to assess kidney function, urine tests to check for protein or blood, and imaging tests to visualize your kidneys. Remember, taking charge of your kidney health is vital for your overall well-being. The kidneys are essential organs that perform numerous functions to keep your body in balance. By recognizing the early signs of kidney damage and taking proactive steps to protect your kidney health, you can significantly reduce your risk of developing more severe issues. Be proactive about your health and educate yourself about kidney disease. Early detection and intervention can lead to better outcomes, helping you maintain a healthy and fulfilling life. Your kidneys deserve attention just like any other part of your body. In this video, we have discussed 5 early signs of kidney damage: fatigue and weakness, changes in urination patterns, swelling in the feet, ankles, and hands, shortness of breath, and high blood pressure. Each of these signs is a critical warning from your body, indicating that you may need to pay closer attention to your kidney health. As we conclude, I encourage you to stay informed about your health and share this video with friends and family. Spreading awareness about kidney health is essential. By educating others about the signs of kidney damage, you can help them take action before it's too late. Don't forget to subscribe to our channel for more informative content related to health and wellness. If you have any questions, personal experiences, or tips to share, please leave a comment below. Your input can help foster a supportive community focused on health and well-being. Thank you for watching, and remember to take care of your kidneys.